Welcome to Your Healthcare Matters. I'm your host, Jenna Sims, and I've worked in healthcare for over a decade. And like many of us, I'm really concerned about the deterioration of our healthcare system. On this podcast, we interview patients, healthcare professionals, and advocates to provide unique perspectives and helpful tips for navigating our failing healthcare system. My goal is to inform, connect, and inspire listeners to take your health into your own hands. My guest today is Camille Currie, the founder of BC Healthcare Matters. She founded this community patient advocacy group to tackle the family doctor crisis. Camille recognized the broader issues affecting hundreds of thousands without a physician and took action by becoming a voice for many communities. Over the past 3 years, she's been on the front line of the battle to fix our healthcare system. In 2023, she was bestowed the Excellence in Health Promotion Award by Doctors of BC for her extraordinary work creating meaningful initiatives that make BC a healthier and safer place to live. Thank you for joining us today, Camille.
I'm so glad to be here, Jenna.
Great. Well, let's hop into it. I'd like to start off by asking what originally inspired you to create BC Healthcare Matters?
Well, in 2022, my family did become one of the 1,000, one of the million that lost their family doctor. And we are a complex care patient family. And so it became very personal. We saw the struggles that we were about to face, and I started doing some research. And what I discovered really quickly was that the system failures that became quite evident to me were actually being disguised by the government as complex situations that we needed to just tolerate and be grateful that we had what we had. And what I also witnessed was that people didn't seem to fully understand why it is that the family doctors were frankly disappearing in British Columbia or why the walk-in clinics were closing. And so I wanted to be part of helping raise awareness and inform people, because if you don't know why something's happening, you really can't truly become an advocate to advocate for the system changes that I saw that we need in British Columbia. So that was part of, I guess, my propulsion into creating BC Healthcare Matters.
Right. I mean, it's unfortunate that you and your family had to experience that, but through that adversity, I'm sure that so many people are grateful that they now have a voice to speak for them, right?
Yeah, well, I really appreciate you sharing that, because that is what it is. You know, I'm always focused on we're going to face challenges in our lives, and things aren't always going to go the right way, but it's about how we come through it and how we use that frustration and that energy to propel positive change.
So if you had to sort of distill BC Healthcare's mission, what would you say that it is?
Well, from day one, our mission has always been that we want to advocate for timely access to a family doctor for everyone in British Columbia. It's really not that complex. But we also want to, our hope is that we continue to help inform the population, inform people as well, so that they can feel confident in being advocates for themselves and feel confident in becoming a team member in the teams that we need to see develop in the future of healthcare across Canada right now.
Right, absolutely. And like you said, if you're not sort of aware that there is a problem, it's hard to advocate for solutions.
You don't know what you don't know,
Mm-hmm.
right? And so BC Healthcare Matters helps inform people.
What would you say makes your group so unique?
It's an interesting question, because there are other advocacy groups out there, in other provinces, within this province, across the country. But I think something that we witnessed right from the beginning that made us very unique is that our group became a safe haven for medical professionals and for patients to come to us to share, to help inform us about what's really happening in the system. We've talked to an abundance of healthcare professionals who have shared their experiences with us, who have shared their struggles, who have also shared positive things, but who feel intimidated or scared to be able to share those thoughts in a public platform where they could be reprimanded by authorities or by their employers. And so it was honestly quite moving to see us become an outlet and a safe place where they could come share those experiences. And it certainly helped inform us. It is the base of, where our wealth of information comes from. But we've also been able to create that opportunity for patients too. So sometimes patients feel like they can't share they can't share their experience, or they can't share their frustration or the struggle they're going through because they worry about losing access to healthcare providers if they speak out of turn, or if they frankly get blackballed, which does sometimes happen in our system. And so again, we were able to create that safe haven for patients alike to be able to share with us what's happening to them. And that as well has helped inform so much of what we bring forward to the public, and how we even bring forward, raising up solutions that the system needs.
I mean, that's amazing that you've been able to create that safe space for both patients and healthcare providers to advocate in a way that they feel is meaningful, right? Because
Mhm.
you've been able to gather so much momentum with this organization that it really does sort of make a difference and allow those people to elevate their voices. So I'm curious, what contributions are you most proud of?
I take immense pride in how our group and our volunteer base, and even some other organizations in BC, were able to come together and mobilize this monstrous public pressure that, in fact, put the BC government in a position that they could not ignore our unified voice. They couldn't ignore the unified calls for patients' needs and for better compensation for family physicians. And so that was just an experience of a lifetime. It truly was, to be able to see our group help bring together patients and medical professionals together, working together, because we had previously seen, other outside sources often trying to pit patients and medical professionals against each other. And so it was, 2022 was this momentous time where we saw that we could come together for a common goal, and that the people were able to see that they have power. That they have power and influence over being able to make a change in this province, and being able to impact, and frankly, pressure change with our government officials as well. So that was definitely a highlight of my lifetime.
That's wonderful. And I really appreciate how your focus is not on finger pointing, but on uniting everybody on a common goal. Because you're right. I feel like certain organizations or people, it benefits them to pit people against each other or to suit their narratives. But I feel like you're really getting to the root of what all of us want, right? And that's really to have accessible healthcare for everyone. And that affects people on both sides, both the providers as well as the patients. So I really appreciate that you put all of this energy into getting everyone together and unified on that point.
Yeah, well, and I think maybe sometimes we lose sight a little bit that what we're all actually after is well-being, improved well-being. And that means improved well-being for people that need care, as well as for those that provide the care. So, the difference between us is really not that big. We have that commonality that we all want well-being.
And I feel like it works both ways. So, being a healthcare provider myself, I'm also a patient sometimes. So, everybody is sort of on the patient side at one point or another, right?
That's an amazing point to make. And, in the first couple months of us creating this group and the work we were doing, that actually came up so often. And it was an incredible message because I think patients actually hadn't heard it enough, where medical practitioners were expressing, don't forget, I'm a patient too. And so many medical professionals that were even sharing that they didn't even have a family doctor. Everybody just kind of might have had this assumption that if you are a working medical professional, that must mean you get everything you need. And I think that was quite a wake up call for a lot of people, myself included as well, to learn about how they were struggling as well in their personal positions.
Right. Because doctors need doctors too.
Yep,
Mhm.
exactly.
So, it sounds like you've already accomplished quite a bit, but what do you sort of foresee for the future for BC Healthcare Matters?
Yeah, well, like you said, I really do think that we cannot forget to acknowledge how much we have accomplished. And BC Healthcare Matters has done that. We have achieved, all the goals that we had set out in 2022, 2023 for raising awareness, for getting people engaged, for becoming, the province-wide advocacy group that is called upon by media so often. And I think for 2024, we've kind of set a goal for ourselves that we want to keep increasing that awareness, and we want to enable people to see their role. So there's a lot of conversations taking place about the future of healthcare being teams. And we want to keep helping reinforce to people that patients are part of the teams, and so are caregivers. And caregivers can be medical professionals, but they can also be just somebody, a citizen that's taking care of one of their loved ones or someone that they know. And for the future, we want to make sure that we would like to see BC Healthcare Matters as a vocal advocate voice at the tables where decisions are being made about patient care. Because it's not truly a collaborative process if you're missing one of the key stakeholders where decisions are being made, and patients are a key stakeholder. So our hope is that we can continue to garner a seat at tables where we can bring forward the patient's voice.
I really like that. I think it's really important to have a focus on client-centered care. Like you said, the client is a huge part of that decision-making process, and they are a very important stakeholder. And sometimes I think some of these older models of paternalism sort of look past that. And I really appreciate that you're advocating for a future where we are working together as a team with both patients and providers.
And I think you kind of you nailed it there, where it's a bit of the way things used to be doesn't mean that that's the way they're going to continue to be. So, patients and citizens aren't at fault here for perhaps not having as active a role. But this is the way of the future, and we need to all take responsibility for our part in our well-being.
So, speaking of the future, what would you like to see in terms of changes for the BC healthcare system?
Well, I would like to see very bold and significant investment in primary care. That is the roots where BC Healthcare Matters started. And while I often will speak to other subject matters like acute care and surgical and wait lists, it always still comes back to primary care. So I would love to see very bold and substantial investment into primary care, because it's been proven that if we invest in primary care, we can reduce the burden on acute care, on our hospitals, on our surgical services, on our specialty services. So it's not to diminish the need for any of those other areas of healthcare, but it's when you look for the root cause of something, that's where we should focus our efforts. And right now, we have a primary care system that is failing the people. People are falling through the cracks. We have disease that is going on, being diagnosed at later stages than it could be. We also have more people possibly just developing disease because they don't have access to primary care. If we invest in primary care, we will be able to enable people to have more preventative medicine, preventative care. And that is really key when we're talking about how do we improve our well-being. It's very important for us to be able to treat cancer, but it would be even better if we could prevent some cancers or catch them sooner. It's great for us to be able to have services where we can treat heart attacks and strokes, but even better than that is being able to identify the markers ahead of time that lead people to having heart attacks and strokes. So, when we think about all these things, you can see how it all comes back to primary care.
Yeah, I think that's a great point. So it sounds like you're saying that you want to invest in the future of healthcare as opposed to sick care. And sort of the foundation for that preventative model is definitely going to be primary care providers. Is that right?
Absolutely. And I just don't think that we are hearing governments across many of our provinces talking specifically enough to primary care, to how they're going to improve the access. And it's important that it can't just be any kind of access. It needs to be timely access. So we even often hear from people that have a primary care provider, but they can't see them in a timely way. And that matters too. So it's not just about the bodies, but it's also about enabling timeliness to those services.
So, what are some of the barriers that you foresee to making these changes?
I think that in British Columbia right now, it's frankly disappointing that we see the BC government continuing to invest in primary care models, or what they call primary care models, like urgent primary care centers. The urgent primary care centers are not providing timely or consistent primary care. That goal is lost. And so when we continue to open more of them, which they continue to do, it's money that is spent in a place that has not had proven results. And I think it would be much better if we examined where those facilities are not providing the efficiencies and effectiveness that we need them to, and redistribute that funding to places where it actually can bolster primary care and where it can bolster access for people.
It sounds like allocation of resources as well as sort of following up to see if the resources that they have created are working or not. So maybe doing a little bit more of a deep dive and sort of problem solving in that sense. Was that accurate?
Absolutely. And, at another level, again, wrapping around to spending, is that we are spending so much money these days on bureaucratic levels or creating more administrative levels within our healthcare system that it's quite alarming. And it's concerning because as we spend more money there, we would expect to be seeing better outcomes for patients. That's how we should be spending in healthcare, is if we spend more, we should see positive effects for patients. And that's not what we're witnessing right now. So I think we need to take a hard look at how bureaucratic bloat is continuing to happen and that there doesn't happen to be any signs right now of that slowing down. And I'd say the last thing is, which revolves around the spending and the urgent primary care centers, is that they're not necessarily attractive places where medical professionals want to go work. We have heard that over and over again from people that either have worked in them or that have just simply not chosen to. So if we are investing in primary care centers, I would sure hope that they are locations that people actually want to work in, because that's kind of pivotal to be able to actually provide for the people.
And I think that's a great point. Being a healthcare provider myself is, just because you can build it doesn't mean they will come, right? You need to create an atmosphere that people are going to want to enjoy working in. And I think that's a really important point.
Exactly.
Mhm. Great. So I wanted to hear a little bit more about your experiences with accessing care for yourself and your family and the things that you learned from those experiences.
So, one of the challenges with being a family with complex care needs is that British Columbia has a lot of silos. So, our family lives in Victoria, and we use some services here on the island. We have some physicians here. We also have an abundance, my children have an abundance of specialists that are located in Vancouver at BC Children's Hospital. And we need those doctors that are over in Vancouver. They provide the best care. They're able to help our children manage their disease. But what happens is every time we have to travel to Vancouver, we have to become kind of this the one that is bestowed all the knowledge from what comes from those appointments. So we have to request copies of all of our notes. We have to request copies of any procedures or tests that are done there in Vancouver. Because once we come back to the island, what often happens is we as patients have no way to access the information that's held in Vancouver because we are in two different health authorities. So as a family that travels between multiple different health authorities, we have actually witnessed information that we can't get. We've also witnessed information that our family doctor can't get access to because the medical record systems don't pair together. They don't share information effectively. And one of our top concerns is often if that information isn't being shared with all of our medical team, how do we always know that everything is being considered when treatment is being provided for our children? It's important that an ER doctor here in Victoria is able to know what kind of medication my children are on that's being prescribed through Vancouver and what the condition is that's being prescribed for and what the cautionary things are that they have to watch for. And it is constantly a struggle for our family. And we have lived in other provinces, so we have experience with other systems, and BC is decades behind where other provinces are at with creating a cohesive system that brings patients' medical records all together in one place so that both the patient and everyone that is part of their medical team can have access to the same information and in a timely way.
I mean, that sounds very frustrating having to be the keeper of all your medical information because all it takes is forgetting one medication that somebody's on, and then you might run into, interactions between the two. So definitely having that continuity of care between health authorities sounds like it would be really essential.
Not only is it the safest, best approach, but sometimes it can be life altering. if that information isn't shared. And again, maybe sometimes there are ways to get the information and access it from one location to another, but can you do it in a timely fashion?
Mhm.
Because I have a child that's had a stroke already, and I'm not willing to sit around and wait for information to be sought or provided um, hours later when he needs treatment right now.
And in this day and age, we have the technology to do this. It's just like you said, it's a matter of silos, not interacting and communicating with each other effectively.
Yeah, and what a lot of people even don't realize is in British Columbia how heavily we still depend on fax machines.
Oh my goodness. Yeah,
And I
it's
don't know
true.
about you, but most businesses even nowadays have gone away from fax machines. We're in the era of electronic transmission of information. And the fact that our healthcare system still depends so heavily on fax machines is absolutely alarming. And it should scare everyone because you just never know. Did that fax get to where it was supposed to get to?
Yeah, it's definitely concerning. And I mean, I haven't even been working in healthcare for that long, but I still remember using paper charts. And in some organizations, they still do use those paper charts. And so, what happens if that paper goes missing or somebody drops it? It's a confidentiality thing as
Mhm.
well as an efficiency thing, like you said, because once you put it into the computer, other people can access it. So I 100% agree. I'd like to know what advice you'd be able to offer BC residents who are feeling frustrated and lost navigating their healthcare journeys.
So, one thing that I always think is really important is acknowledging the frustration that people feel. Far too often, we see pleasantries used or methods to try to even suppress people's reactions. And I think we should encourage people to feel frustrated, acknowledge it. It's a real thing, and that the conditions that have led to that, they're not imagining it. Those are real conditions causing those feelings. But then I encourage people to understand that frustration can also be used as a very positive, or very powerful tool to create positive change. So I myself have faced so much frustration with the healthcare system in British Columbia. And I take my moments to really feel that frustration. And then what I do is turn it into positive energy to try to create positive changes for those that might come after us, or to make that situation easier next time that we're faced with it. I think that frustration really opens up an opportunity for learning as well. So when you're frustrated by something, it's important to ask yourself if you understand the conditions, the root causes that are leading to your frustration, because sometimes we don't. And once we start to understand it, we can also, we can manage our frustration a bit so we can feel a little bit better within ourselves. And also, we can feel more enabled to be proactive about, again, either making a change or advocating for a change or doing something differently next time as well. So I think that's important too, is for people to identify, can they do something differently next time? When you feel frustrated by the system, look for different opportunities.
That's a great suggestion. Do you have any examples of sort of opportunities that you've come across for navigating things yourself?
Yeah, one of the big ones actually is that I think too often, and I say this because I've talked to a few people to try to get a sense of where people are at with this. But people often think that they're put on cancellation lists automatically. So if you're waiting for an MRI or an ultrasound or waiting for a surgery or to see a specialist, you just kind of assume, well, my need is important. And I'm sure if something comes up sooner, I'll be moved up that priority list. But that's not the truth for the most part. There may be some practitioners out there that do that, do their own prioritizing and move people up. But when it comes to MRIs, it comes to ultrasounds, it comes to surgeries, you actually need to make the phone call to the hospitals, the facilities, or the doctor's offices and ask to be added to these cancellation lists. And, that was a bit of a learned experience for our family. We went through that. Our son needed surgery. His condition was deteriorating. And I called to find out, will he be bumped up in priority? And that's when they flat out told us, oh, well, you didn't ask to be put on the cancellation list. So there's all these little parts, that sometimes when you go through something really traumatic and really frustrating, you can still walk away with a great new piece of information that will help guide you in a different way the next time. And sure enough, my son had another surgery within a year. And you can bet we were extremely proactive at making sure he was on the cancellation list and making sure that they understood that we would be willing to respond at a moment's notice.
I think that's great advice, especially keeping in mind that a lot of these lists are made based off of medical necessity. So you may have had a certain level of medical necessity when the appointment was initially booked. But like you said, if there's a change in condition, you definitely need to reach out to either your doctor or the hospital to let them know, because there are things that they can do, like put you on that wait list, and it really can make a difference.
And, it wraps us back around a little bit to primary care too, though, because what I've also witnessed is that sometimes it's very difficult for people to report a deterioration or a change in their health status when they don't have a primary care provider to actually help bring that information forward and forward it along. So sometimes it's easier and you can make phone calls to, the end source, either the specialist office or the hospital, the surgeon. But other times, it honestly is very challenging to get through to those locations, and they will insist that you have to report to your primary care provider first and that they have to report forward to them that your condition has deteriorated. So I think it's important also to not lose sight, of the fact that even with all these, tips or suggestions and how do we do things differently to mitigate a system that's collapsing, sometimes we are still held back by the lack of access to primary care. And that goes back to, my initial statement about where do I think we need to make a big change. Once again, this all wraps around to being able to access a family doctor or nurse practitioner.
Because they really are the ones who are going to be able to be your biggest advocate in your healthcare journey, right?
Exactly. Yeah.
Mhm.
We play an important role as patients, but we're not trained as medical professionals. And so we need to work as team members with a primary care provider.
So I know the topics that we've been spanning are quite complex and there's a lot of them. So I just want to make sure I didn't forget to ask you something. So is there anything else you wanted to throw in?
I guess I would just say it's really important for people to remember that perseverance is important. So things don't always change at the snap of a finger. You won't always get the responses you want. Dealing within the healthcare system can be soul crushing sometimes, but persistence is really key. People need to keep persisting, even when change or responses are coming slowly.
I 100% agree. And I feel like that's why it's so important that you've created this group to give people a community to talk to about this. Because I think a lot of the time, things like climate change, we're like, oh, well, there's nothing I can really do. And we get this apathy, right? But I think you really created a pathway where we can support each other as a community and create some of that positive change.
Because persistence goes hand in hand with hope. And when we
Absolutely.
lose hope, it can be catastrophic.
Mhm.
And we need to still maintain hope. I have hope. It is not, this system is not at a point where we won't be able to come back from it and repair it and reform it. I have hope that we can do all that. We just need the right people at the table that are making those decisions, and we need the patient's voice heard loud and clear.
So it sounds like advocacy is a really key component of all of this. So can you describe for us what advocacy looks like and means to you?
I think that, first of all, something we should identify is that often people confuse advocacy and complaining, and they are two very different entities. Complaining is being upset and disgruntled about something, but not necessarily taking actions to change anything. Advocacy is about being disgruntled, being upset, but taking actions to make a difference. So I think that's really important because I often hear people suggest that, well, you're just complaining. That's not what advocacy is. Advocacy is about airing your complaints because that's important. That's how we learn. But then it's continuing to move forward towards the solutions, continuing to look at how can we do it differently next time. Advocacy is about bringing many voices together to create a united call for change. So it's pivotal to reforms that we need within our healthcare system. And it can't happen without having all the stakeholders at the table. And patients are a key part, medical practitioners are a key part, So are those that administer the system. And that's truly when advocacy can achieve the best results, is when we're all at the table, airing our grievances, but doing it in a polite way, doing it in a persistent way, and demanding better outcomes.
So, for listeners who want to take action, can you offer them some suggestions on how they can be a force for driving change?
Oh, I would say the first one would probably be what I've said a few times, which is persistence.
Right.
You need to remain persistent. We live in a generation where often we want instant gratification of things, and healthcare is not going to be one of those areas. You need to remain persistent, even when change comes at a slower rate than we would like to see. I would say it's also very important to get informed and to truly understand the root causes to issues. When we become megaphones for regurgitating misinformation, we don't help anybody. So it's important to make sure that you research. When you hear something, you fact check it. That's a big piece of what BC Healthcare Matters does. I would also say that volunteering is always great. We're talking about a healthcare system that has a lack of human resources within every department right now. So if you can do something in a volunteering capacity, why not do that? Or if you can volunteer with an organization like ours or others within your city, then do that. Help be part of bringing forward the solutions. And as we talked about before, kind of bringing people together to make sure we still keep having that hope for the future. Another important thing that we spoke about earlier was, the attractiveness of family medicine. So right now we do hear about individuals that just aren't attracted to going into family medicine. And I think it's important to acknowledge that the people can actually have an impact on that. If we help create supportive environments, if we take a minute to acknowledge to a primary care provider that we're grateful for a service that they provided to us, that can go a long ways. That helps create an environment where you feel that your work is being valued. And I would say the last thing is that people need to advocate. They simply need to advocate. They need to advocate to their provincial and their federal elected officials. They need to write letters, because it's like we've talked about a few times today. If you haven't experienced something, you may not truly appreciate the effect it can have on someone. So sharing your story, sharing what you or your family or your friends has been through, can actually really help increase awareness with elected officials as well. They only know what they know. And if, an elected official has had a fairly great life in the sense that their well-being hasn't been an issue, they may not be as in tune as you would like with understanding the struggles that you're facing in your community. So I think people need to look at that as an opportunity to help inform. We tend to think that elected officials must know more than us. That's not always the case.
Yeah, that's a great point. I will speak personally about what you said about volunteering. Having been a volunteer coordinator myself and working with seniors, it was so essential to so much of our programming, and the residents always loved having volunteers come in. So it really does make a difference. So if people do have, a few hours to volunteer here or there, any position in the healthcare system that accepts volunteers, I'm sure would be happy to have them.
Yeah, and you make a really important point, is even an hour or two here or there can make a difference. People don't need to feel like it requires a full-time 40 hours a week commitment, right? And there is a difference as well between a volunteer that comes into a hospital, long-term care setting, or I don't know, even like a youth or mental well-being center, versus somebody that's working there that might be maxed out right now, that does their 40 hours a week or does 80 hours a week for all we know. And they just don't have that much left to give right now. But somebody that can volunteer, you have more to give. You have more joy that you can bring into that environment, and that can make a world of difference.
And speaking from experience, volunteering is a two-way street, right? It's mutually beneficial. It definitely makes me feel a lot better volunteering for an hour than sort of screaming into the void on the internet, right? So taking that action and being able to positively impact other people's lives, I think, is a lot healthier.
Yes, I agree.
Great. Well, thank you so much for this inspiring conversation. I really appreciated it.
Well, thank you for your time. I think we need to keep encouraging everyone everywhere to do more of this. If we talk about things, then, we are all more informed and we're able to do the advocating that needs to happen.
Remember, together we can advocate for the healthcare that we all need. The content provided on Your Healthcare Matters is for informational purposes only and is not intended as medical advice. Always consult with a qualified healthcare professional regarding any medical concerns. The opinions expressed by guests are their own and do not necessarily reflect the views of the podcast or host.